Carbon dioxide, CO2, isn't much used for colonoscopy, but it probably should be. Nearly 80% of the air insufflated into the colon is nitrogen, an inert gas which isn't absorbed. The patient is inevitably left distended at the end of the procedure. Even if the endoscopist remembers to aspirate the colon before finishing, the proximal colon and the ileum will retain air for hours, with after effects for the patient of pain, distension, nausea and flatulence. This is the same patient 20 minutes later because only carbon dioxide was used for insufflation and it's been absorbed into the portal bloodstream and breathed out. So the proximal colon and the small intestine are already virtually empty of gas. Experiments show that CO2 is absorbed from the gut 100 times faster than air, which is why the Olympus ECR or endoscope CO2 regulator has been designed. It has complex safety features inside to ensure that the high pressure of the cylinder can never endanger the patient. The gas flow is regulated to be around 2 litres a minute, the same as normal for colonoscopy, and to stay the same even when the cylinder is nearly empty. The ECR is simple to use and is joined up by a tube and connector to pressurize the water bottle of newer scopes, or to the CO2 connection near the light guide plug of older instruments. The air pump on the light source is turned off, and the normal air-water valve replaced by a grey-topped CO2 valve, specially designed not to leak and waste CO2 when not in use. Just covering the CO2 valve with the finger does nothing. A light press causes CO2 insufflation. A hard, sustained press activates water wash of the lens. Because the mechanism of the CO2 valve is complex, the two rubber O-rings on it have to be made thinner, so more delicate than those on the air valve. So the CO2 valve O-rings need to be carefully checked for damage or stretching after cleaning and disinfection, and quite frequently need to be replaced with new ones to ensure proper functioning. Our experience and a clinical trial shows that using CO2 rather than air insufflation, patients have significantly less pain, bloating and flatulence. This bonus of using CO2 is apparent for up to 24 hours with less pain, probably because the colon has been less distended. Nurses appreciate CO2 insufflation because recovery is easier and faster. Though carbon dioxide isn't used by many for colonoscopy, it should be. The equipment is available and easy to use. Give it a trial for your patient's sake.